An institutional review board is essentially a committee of professors, researchers, some community members, and it's their responsibility to review all research involving human subjects that anyone affiliated with the university engages in. And their primary goal, in my opinion, is the protection of human participants, or the protection of human subjects. You know, once they've given approval for a research study, they're also responsible for oversight, for making sure that the study is conducted as it was approved by the board. The federal government has developed guidelines, and they require that any agency, whether it's a university, hospital, whatever, that receives federal funding, they have to abide by the guidelines that the U.S. Department of Health and Human Services has established. If rules are broken, then that jeopardizes the current research that you're doing. They can, you know, require you to stop the research. There's a fine line between what's ethical and what's not ethical, and for some people it might be difficult to determine where that line is. There are many studies that were done in the 60s and 70s that were publicized, and many people began to just identify those studies as being harmful and unethical and deceiving patients and clients or participants that were in the study. With the Tuskegee, I mean, that was probably the worst of the worst, was withholding treatment from the participants in the studies for about 30 years, when they could have received treatment which would have cured them. So that's probably one of the worst, but I think, that definitely as a result of that, that's why the institutional review boards and human subjects review boards were created, to try to prevent that same sort of type of research from repeating itself.